You're welcome to my channel. Thanks for visiting. Yes, you click on this because you saw the name Farxiga, either FAR in America or FOR in Canada. The generic name is Dapagliflozin. Without further ado, let's delve deeper into what Farxiga is all about. First thing first, the first note here is that this medication has been manufactured for the treatment of type 2 diabetes mellitus, but that will not be the first line in the management of type 2. The reason is, first line is always lifestyle modification in type 2 diabetes mellitus, and that will take us to the control of the diet. Exercise, stop smoking, take alcohol off the table, don't indulge yourself in doing street drugs. You will know more about sodium glucose cotransporter 2 in a bit, and this medication is specifically manufactured to prevent the action of this cotransporter. Why that? You'll know in a bit. It could be under a different brand name, like we're familiar with Farxiga in America, these FOR in Canada. Other countries could adopt different brand names. You can go through. Belongs to the class of medications known as anti-diabetic agent, specifically against type 2 diabetes mellitus. It is a sodium glucose cotransporter 2 inhibitor, meaning it will prevent sodium and glucose reabsorption back into the plasma after they've been filtered. Now, I will be going straight to mechanism of action. I have published a separate presentation on mechanism of action of Farxiga alone. If you want to listen to that, you can click on this link, but you may pause and read through because the next slide will be about this. For those who don't want to get out of this presentation, don't worry. You can listen to the full mechanism of action on the next slide. Mechanism of action of Farxiga. Sodium glucose cotransporter 2 is found in the kidney, helping in regulating glucose and sodium. Reabsorption of these two items is expected to take place at proximal renal tubule majorly. Particularly, glucose will be almost completely reabsorbed when filtered. It will be completely reabsorbed at proximal renal tubule. But sodium will be majorly reabsorbed. Other parts of the renal tubule will also help, as per sodium. This cotransporter is inhibited by Farxiga, leading to less glucose back in the plasma, at the same time sending out sodium while sending out glucose. So we are going to lose glucose, sodium, and water in urine. Why that? Wherever sodium is, water will follow. Renal glucose transport maxima is also lowered. This is another way by which Farxiga does its job. Hence, more glucose is lost because less glucose could be transported by the kidney after you've ingested glucose any way you've done it. A drop in blood pressure will occur. Why that? Because of the massive loss of sodium and water. And the level of glucose will drop to normal, that is glycemia, or even below normal, called hypoglycemia. Why that? Glucose is lost and less could be transported, less could be reabsorbed back into the plasma. Then another trouble is this. The search for the source of energy will then start because glucose is the main source. Now we don't have enough. Hence, the body will go and get the source from fats, breaking it down, then getting more ketones in that process, leading to ketoacidosis. But remember, we will likely have euglycemia or hypoglycemia. So the ketoacidosis here is called euglycemic ketoacidosis, written in this form. From the mechanism of action we just listened to, let me reiterate again that Farxiga will help us to get rid of glucose. Glucose is lost. Water will be lost, sodium will be lost, because wherever sodium goes, water will follow. The source of energy is known to be glucose, but now that we don't have much glucose again in the system, the body will start sourcing for the energy from fat, and that will lead to breaking down of the fat, and in the process, ketones are produced. Remember, water is lost, sodium is lost, so we are dehydrated, and with dehydration, we have hypotension, and already with massive ketones in dehydration and everything around us, then we'll be dealing with euglycemic ketoacidosis. Uses. Needless to say that it's used in type 2 diabetes mellitus, but also helpful in chronic kidney disease and heart failure, particularly with reduced ejection fraction. However, its use in chronic kidney disease is not in all cases of chronic kidney disease, because if this is caused by polycystic kidney disease or an autoimmune condition, and the individual is on medication to handle the autoimmune with immune suppressant agent, then we cannot use Farxiga in these conditions. But remember that diabetes would destroy the kidney and destroy the heart. Now you have a medication that will handle both the diabetes mellitus type 2, the kidney itself, and the heart itself. Contraindications. It's a good medication, but we cannot use it under every conditions. No. When there is hypersensitivity reaction to Farxiga or any component of its formulation, we don't use it. In anyone undergoing dialysis, either hemodialysis or peritoneal dialysis, no Farxiga. In anyone having continuous renal replacement therapy, not today. If you are on prolonged intermittent renal replacement therapy, Farxiga is off the table. Can come in form of tablet for per oral use at the strength of 5 mg or 10 mg. Now, adverse reactions. That might be hypersensitivity reaction, might be to Farxiga itself or the components of its formulation. If that is the case, that should be recorded, please. There may be acute kidney injury. Also, we may be faced with bone fractures, nausea, dyslipidemia, particularly high level of LDL. We don't want that to happen, right? We want HDL to be high and LDL to be low. We might run into acute pancreatitis. Also, hypercalcemia may be possible. There may be skeletal pain. Remember, possibility of bone fractures, right? Hypotension. Remember, we're going to lose sodium and water, then we have dehydration. Of course, there'll be hypotension. And when there's hypotension, there could be syncope. Infection is a possibility with the use of Farxiga, particularly in the perineal area and renal system. Ketoacidosis is a possibility from massive ketone production while the body is sourcing for the source of energy from fats. 1. Anyone undergoing or had undergone bariatric surgery should be careful with Farxiga because there might be altered absorption, dehydration, and more ketoacidosis. Still under warning, remember the possibility of infection, like I said earlier, but the infection is not limited to perineal region. It can even affect the bone, like we can be down with osteomyelitis. In renal insufficiency, there might be inadequate effect of the medication. Remember, it's going to work upon the renal system, particularly the renal tube. And when the kidney is already failing, where will the um, water and sodium, including glucose, go? Please discontinue at about 3 days before any known plan or elective surgery. It is not meant for the treatment of diabetic ketoacidosis or the treatment of type 1 diabetes mellitus. No, it is not meant for that. Still on warning. This medication is not good for a pregnant woman. We don't expect anyone that is pregnant or breastfeeding to be on this medication. In fact, the expectation is that contraception will be in place while on this medication in any woman of childbearing age, and particularly those who have shown interest in having pregnancy. Why that? It could lead to preeclampsia. And when preeclampsia is not adequately corrected, it could lead to full-blown eclampsia. There may be spontaneous abortion or preterm delivery. All these conditions will not let the pregnant women to say thank you to their physicians. But now we know that Farxiga is not for a pregnant woman. There is that likelihood of renal developmental anomalies in the fetus, but not so certain about it. So that's why I put not sure of the possibility of renal developmental anomalies. Monitoring. We'll keep an eye on the value of the glucose and will titrate as it is appropriate. Hemoglobin A1C will tell us how deep the medication is hitting the diabetes mellitus. Vital signs, the blood pressure, respiratory rate, heart rate, including temperature, and of course physical examination to see how well we're doing. Lipid profile, remember the possibility of high level of LDL. We don't want that. Renal function test, of course. This is going to work within the kidney, the renal tube, and we want to know what's happening to the electrolytes. No? Remember, we're going to lose sodium and water. And all other possible side effects should be checked out in anyone on Farxiga, particularly on it for a long time. Now, in conclusion, diabetes mellitus is bad for the heart and the kidneys, but lucky enough, Farxiga will deal with both diabetes mellitus and other organs that it could damage, like the heart and the kidneys. So, this is a good medication, but it could be bad if not used appropriately. Don't transfer medication to your friends or family members. Don't borrow medication from your grandpa, grandma, your friend, spouses, or anyone else around you. Have that interaction with your physician. Let that determination be made. Then go ahead as it's being prescribed. Remember, prescription drugs can also kill. Please watch out. Thanks for listening. Please remember to share this with all your friends. Thank you. I appreciate it.